We did see a slight pickup in new infections after yesterday. We had the lowest number in almost 6 weeks. Are there still doubts about the data at this point?
There are. I mean, every day that we report these confirmed cases from China and the death rate and the numbers of people who've been discharged, we always put that asterisk around it, that caveat to say that we still can't be 100% certain, at least according to experts outside of China, that this data is trustworthy. And indeed, when you just speak to regular people on the ground here in China, they're very skeptical about the numbers coming out of the government. But there's another reason, which is some reporting done by Bloomberg citing some investigations by Taixing magazine looking at asymptomatic patients. So these are patients who test positive for the disease but don't show signs of any symptoms. And according to that reporting, in a number of cases, these asymptomatic cases are not being added to the total count. They're not being included in the total count by China. So we're not necessarily getting the whole picture. And again, that really underscores the concern about the viability of the numbers that we get out on a daily basis out of China and what has been looking like a positive story. And again, if you take the numbers on face value today, even with that increase that you saw from yesterday, 139 versus 119 yesterday, it doesn't undermine the case, again, if you take the official data at face value, that the rate of infections continues to moderate here. But again, that example of the asymptomatic cases not being included in the total underscores that concern. But nonetheless, you know, we are looking, it seems like trending lower in terms of overall infections. The majority of the death case rates, of course, are still in Hubei. The majority of additional infections are still in Hubei. And the numbers of people being discharged are now above 52,000. But again, it just raises questions. And it looks very different in terms of the way China's approached this disease to what's happening in South Korea, for example, where they're testing far more people. And it seems like being more transparent about the numbers in that country.
Well, we have lots of questions about the numbers here in the U.S. as well, Tom. 11 deaths already when they say there are only 100 and so confirmed cases, which doesn't really seem to make sense. We continue to see this global spread.
Absolutely. And look, yeah, China's not alone in struggling with how to define what is a confirmed case, what is a suspected case, for example. And of course, the US has had problems with its own CDC-issued testing kits, and they're trying to address those issues. And they've said, Mike Pence, the vice president, of course, has said that they're going to ease those conditions around which medical experts in the US can use those testing kits. But yes, in the United States, there's a concern, of course, 11 confirmed deaths, at least 11 confirmed cases of the virus in states ranging from California to Oregon to New York City, of course. And they're all trying to wrap their hands around how to control this challenge. Over in this part of the world, of course, South Korea is still in focus, more than 5,300 confirmed cases. As I said, they are testing many, many people there. About 130,000 people have been tested by the South Koreans. In the Middle East, it's still Iran that's the hotspot, around 3,000 confirmed cases and a number, dozens of deaths, in fact, in that country. Europe, you see more cases in, for example, the United Kingdom. You've got about 85 confirmed cases there, more cases in France, Germany, Italy. The European Commission coming out, at least not publicly, but according to our reporting, have said and warned that the European countries, including Italy and France, could be dragged into recession as a result of the impact of this virus. And of course, we do have a task force that's been put together in Europe to try and curtail this virus as well. But certainly it continues day by day. The count in terms of infection rates continues around the world.